Good morning, everyone. We are Catalina Pinzon and Santiago Reina and Kevin Villanueva. Today, we are present our system and literature review entitled Association between Sleep Deficit and Cardiovascular Risks are the size in adults. Next. Okay, entonces, sleep disorder and a major public health problem and have been associated with increased risk of cardiovascular disease. Approximately 25 to 30% on adults suffer from chronic insomnia, while cardiovascular disease remain the leading cause of death worldwide. Because of this growing concern, we conduct a systematic review to evaluate the association between sleep deficit and cardiovascular risks in adults. Next, please. Okay, to answer our rich question, we asked the PICO strategy. The population include adult with sleep disturbance. The exposure was a sleep deficit, include insomnia, poor sleep quality, sleep deprivation, and sleepless seven or per night. The comparison group include adult with equine sleep duration and good sleep quality. The main outcomes were hypertension, cardiovascular disease, and cardiovascular risks. Next. Okay, for this systematic review, we use the Prospero framework to formulate a structural research question. This approach helped us clearing define the population exposure comparison and outcome behind the literature search. Next. Okay, keywords and search strategies. We perform a comprehensive search using mesh index term relating to sleep disorders and cardiovascular risks. Keywords include insomnia, sleep deprivation, sleep disturbance, cardiovascular disease, and cardiovascular risk factors. The search was conducted in English to Spanish to identify the greatest number of relevant students.
We search high-impact databases, including the Scopus and the National Library of Medicine. The search combined terms related to sleep disorders and cardiovascular risk using Boolean operators such as and or. This strategy allowed us to identify relevant studies on the relationship between sleep deprivation and cardiovascular disease.
Okay, now a systematic review was conducted to analyze the association between sleep deficit and cardiovascular risk in adults. PubMed and Scopus were used as scientific database, and RIA was used to organize and select the article or studies. Next, please. This search included terms related to sleep disturbance and cardiovascular risk, combined with Boolean operations such as and or. Initially, 32 results were found in PubMed and 3,590 in Scopus. Inclusion and exclusion criteria. Studies in adults that evaluate sleep disturbance and cardiovascular harm were included. Studies in children, adolescents, pregnant, women, geriatric population, terminal patient, or those using non-valid sleep tools were excluded in our studies. Next, please. In data quality, the quality of the 20 observational study was assessed using the stroke tool. Risk of bias was evaluated in areas such as confounding, expert measures, participant selection, missing data, outcomes, and reported results. And data analysis. Next, please. Data analysis information was organized in analysis matrix because studies were heterogeneous and narrative and descriptive synthesis was performed, grouping the findings by sleep disturbance and cardiovascular outcomes.
Well, about the results, we follow the PRISMA guidelines for study selection. Our research identified 3662 records after removing duplicates and screening titles, and abstracts 180 articles under one full text review. Following quality assessment with the stroke tool, 20 studies were included in the final analysis, providing a strong and reliable evidence base. About the study characteristics, most of the included studies were published between 2023 and 2026, highlighting the growing interest of the topic. The largest contributions came from United States, China, and the United Kingdom. Prospective cohort studies were the most common designed, providing strong evidence on the long-term effects of sleep and cardiovascular health. About the population and confusing factors, the studies include a population ranging from small clinical groups to more than 1.7 million participants. Age varied from adolescence to older adulthood. Importantly, most studies adjusted for confusing factors such as BMA, smoking, alcohol use, physical activity, and comorbidities, strengthening the reliability of the findings. About the key findings, overview identified these 5 case findings. First of all, sleep deprivation and insomnia increase the risk of hypertension. 2, poor sleep is associated with major cardiovascular events, including heart attack, stroke, heart failure, and atrial fibrillation. 3, poor quality increases long-term cardiovascular risk. 4, insufficient sleep is linked to obesity and adverse cardiometabolic profiles. And 5, poor sleep is associated with endothelial dysfunction and other cardiovascular biomarkers. Overall, the evidence consistently shows that inadequate sleep is an important risk factor for cardiovascular disease.
Okay, continue basic interpretation and physiology. Our findings suggest that sleep deficit is association with increased cardiovascular risks. The most common sleep alternatives were short sleep duration, insomnia, and for sleep quality. Possible mechanisms include sympathetic nervous symptomatic activation, increased cortisol release, chronic inflammation, oxidative stress, insulin resistant, and endothelial dysfunction. Next. Comparison of students. Most students consistently show that sleep disturbance are associated with a heart atrial fibrillation and heart failure. Around some methodologic difference excite among students, the overall evidence remain consistent. Next. Okay. The main strength of the review were the inclusions of device population from the first region of the world and systematic search strategies, and the methodology ASEM use the stroke tool. The main limitation were student heterogeneous is self-report sleep measure and the observational design of the include studies which limit the ability to establish quietly.
Okay, now in conclusion, the systematic review finds that sleep deprivation increases cardiovascular risk in adults. Insomnia, poor sleep quality, and short sleep duration were associated with outcomes such as hypertension, myocardial infarction, stroke, atrial fibrillation, and heart failure. Most studies had level 2 or 3 evidence supporting a moderate overall quality of evidence according to grades. These findings highlight the importance of managing the sleep disorder to prevent cardiovascular disease. And thank you for your attention.
Bueno, terminamos.
Pues yo dije las conclusiones así rápido, no pasa nada.